Good Wellness Watch, sponsored by the African American Wellness Project, BlackDoctor.org, and the Alameda Alliance for Health. Today, we're going to talk with Dr. Oliver Brooks. He's the CMO of the Watts Community Healthcare Corporation. He's not only been on the front lines of taking care of patients and children, especially around the COVID-19 infection, but also on policy boards determining how we do what we do with this infection. Welcome to our program, Dr. Brooks.
All right, thank you for having me again, Dr. LeNoir. Happy to be here.
Now, tell us exactly how you feel about where we are now compared to where we were at this time last year.
I think that's a very good question because we need to see the trend. Need to see where we were, where we are, and theoretically, therefore, where we are going. So SARS-CoV-2 virus hit us as a pandemic in January. By March, we were having lockdowns. So fast forward from March 2020 to December 2020. December 2020, we were having a peak in cases. We were calling them these surges. So we also had the emergency use authorization approval for both the mRNA vaccines, Pfizer and Moderna. So at the same time that we were hitting at a height of cases, high hospitalization, high death, high case rate, we had a mitigator, a vaccine coming forth. So we were in a very interesting point. We were in a crucial, critical place in terms of the pandemic. Fast forward 12 months later, we have a vaccine that has now gotten to 60+% of the United States fully vaccinated. We have a new variant that's not as deadly. We have treatments. So we have our arms around this virus now, this SARS-CoV-2 virus. We didn't have our arms around it last year. But that being stated, the virus has been oiled. So even though we have our arms around it, it's slippery and it's hard to keep a grasp on it, a hold on it. So I would say we're obviously in a better place than we were 12 months ago. And I'm foreseeing us to be even in a better place as we move into 2022.
As a physician on the front lines of this whole pandemic, what's been the hardest part for you in terms of trying to care for patients?
So I'll say a couple of things. Number one is following infection control procedures. It's constant. It's also sometimes changing. There are times when you don't have to be in full PPE, but sometimes when you do need to be in full PPE. The concept now is healthcare providers of COVID fatigue. This wears on a person, and it's like being on steroids all the time, adrenaline always up. So that has been a challenge. And then also the side of having to take care of people who are sick from a virus that can be deadly. So you worry, will my patient get better? Will they end up on a ventilator? And 80% of people on ventilators don't tend to get off of them. So just the whole concept of the high level infectious disease causing death, hospitalization, and stress. So just underline, just general stress.
Review with us now the protocols for who gets vaccinated and what do you see happening in the future with regard to infants?
Okay, so right now the vaccine, this is the Pfizer vaccine, is indicated for all individuals 5 years and up. There's also the Moderna vaccine, 18 years and up, and then there's the Johnson & Johnson, the Janssen vaccine, 18 years and up. So everyone theoretically should be vaccinated. There are very, very few contraindications. We now have the recommendation of using the messenger RNAs over the Johnson & Johnson vaccine due to some side effects that were found with the Johnson & Johnson vaccine. But there's still people who may want to get the J&J because it's one shot and you're done till you get to a booster. So the other thing we now have is a recommendation for a booster and headed toward, in some places there, with a mandate for a booster. So you get your first two mRNA shots 3 to 4 weeks apart, and then you get your booster 6 months after that second dose. If you got the J&J, you get a booster 2 months after your initial one. And they're all interchangeable. You can get any vaccine you want as your booster. Don't sweat that. So that's more or less where we are. We still, however, have some issues, and in our community, we have the lowest rates of vaccination, lowest rates of getting a booster, and the highest case rates. So that is a challenge that we now face.
Well, one of the problems is people want to know why a booster, and if you're getting boosted, why after two vaccines and a booster are people still getting infected with certainly this variant and even with the Delta variant before it? Some of my patients will say, "Well, I'm not, I'm not going to get this vaccine because people who getting the vaccine, they're getting the disease."
Right, and there is actual truth to that statement, but let's look a little more closely at it so they can clearly understand. The reason you need a booster is because we have found that the protection provided by the vaccine wanes. It goes away, it gets old. So when those antibody levels drop, when the immune response drops, you are again susceptible or more susceptible to the disease, to the virus. So when you get boosted right back up. So it's like if you had gas in your tank, and then you drove and drove and drove, and you still want to keep moving, you got to put some more gas in the tank. So the booster just boosts up your antibody levels, your immune system. Now, the thing is, with the circulating virus right now, which is the Omicron virus, which you all have heard of, it can slip by your defenses, and it can get a toehold and then replicate and make you sick. However, the vaccine is like, instead of you having no defenses, you got you got 100 soldiers. Maybe you need 300 soldiers, but that's different than having no soldiers. So what happens if you do get sick, or excuse me, if you do get the Omicron infection or even Delta, even if you get infected, you are less likely to get hospitalized, less likely to die, less likely to spread it. At the beginning, we saw 100% of the people in the hospital were unvaccinated. We're still seeing the high majority of those that are hospitalized are under vaccinated. So that's a crucial point to remember. Look, the vaccine is safe and effective. It works. If you don't get it, you may end up dead or in the hospital. If you do get it, you won't be.
We're still dealing, certainly in my practice, with some of the myths. I don't know where the information is coming from. I don't think it's necessarily coming as much from the internet as people think. I think it's kind of word of mouth. Let's deal with a couple of those, because I don't think that this discussion is going to change very much in terms of philosophy. We just have to keep talking about it. All right, one of the first questions: why should I give this to my children? Children don't seem to be having too much trouble with this virus.
Right. So the children have endured well through this pandemic. There were 8,500, I think, deaths, no hospitalizations, even less deaths. But there were millions of cases. So a couple of things. First of all, after infection, children can get a condition called MIS-C, multi-system inflammatory syndrome of children. That can lead to death. And that comes after COVID. So even though they don't get sick from COVID, they can get this. I think more importantly, or as importantly, a couple of things. One, children are vectors. Vectors means something that spreads something. You get malaria, you get from a mosquito. The mosquito is the vector. The child is a vector. They sneeze, they cough, then they go rub on grandpa. So they can spread it to others. But really importantly, as a pediatrician, when they get it, they can't go to school. And so we have seen so many disruptions in children's education. Remember last year, they were all at home. I don't think they were learning a whole lot. They were learning how to play on their phones and talk to their friends, but I don't think they learned a whole lot that they needed to be learning. So when we get it under control with the children, it reduces the illness in adults, allows the children to go to school, to be social, to learn, to get out of the house so mom and dad can go to work. So it is crucial that children get it. And I want to underscore, the vaccine down to age 5 for Pfizer is safe and effective. Children respond better to the vaccine than adults. Children's immune systems are like supercharged. So the highest and the best rate of response to a vaccine is at age 11. Okay, from that point, it's all downhill.
I think that there are other myths that I think seem to perpetuate. All my patients seems to know someone who's died from getting the coronavirus vaccine. How often really is that a problem, and has that been reported in any way widespread through the African American community, especially?
Right. So I don't believe, and I'll have to double check. I don't believe there are any deaths directly attributable to the vaccines. There are some significant side effects. You can have a super allergic reaction called an anaphylactic super reaction, but there are no reports of death. There's side effects with the myocarditis with the mRNA vaccines, but the children or the people that got the myocarditis get a mild case, primarily young males, and no deaths. There were a few deaths, I will say that, with the Johnson & Johnson vaccine, with the blood clots in the brain, but that's of some concern. However, the number of deaths from COVID-19 in the United States are above 800,000. Okay, so there's always some risk somewhere, but the risk is probably 10,000 times greater with the disease versus the vaccine.
Yeah, another one thing that I hear is, well, I heard that the virus infection is not such a big deal, and that if I get it naturally, I'll be better protected anyway. What about the issue of long haulers?
Yeah, so I am more afraid personally of long COVID. Long COVID means that you're having symptoms 6 months or more outside of your acute infection after you've gotten better, after you've tested negative, whatever. So that is untreatable. Don't really know why it happens, and it can stay with you forever. So the most common things we see are fatigue, brain fog, which is poor cognition, headache. So I couldn't imagine having those things that far out. So the vaccine protects from that. There's even some data that shows that, okay, and then you mentioned getting infected in a natural immunity. So the same way that your immunity falls off from the vaccine, hence the need for a booster, the immunity from the natural disease, which is again kind of different. A lot of natural disease does provide good immunity, but with this novel coronavirus, it doesn't. So no, and now that there's information coming out of data showing that even if you got COVID, you are hospitalized, if you get vaccinated, you are less likely to get long COVID. So I guess I would just want to implore on those who still are really hesitant that the benefits outweigh the risks by, again, 10,000 times. Okay, that's the best. That's the best we can do. I mean, you feel happy we have this vaccine. That's the way I look at it.
Can you take us through a situation where you had a parent who said, "I'm not going to get the vaccine"? You explained it to them, and they changed their mind. And what was the dynamic in that discussion? Was it just
Well,
simply the trust of your judgment, or
right.
were you able to say things that were, I think, convincing to the parents?
Well, I think it was a little bit of both because at least here in California, the children are mandated to be vaccinated. They can't go to school, so that's a very powerful incentive. So mother told me that her child was 11, and she did not want him to get vaccinated because she just didn't trust the vaccine for all the reasons that you stated and probably others too. So I mean, I told her, first of all, I'm a pediatrician, a Black pediatrician here in Watts, it's an underserved community. I get no money, no benefit from telling you to get your child vaccinated. So there's no vested interest. I'm not, I don't get paid by the shot. I told her that if I'm vaccinated, my children are adults now, but if they were children, I'd have them vaccinated. And she said, yeah, she said, yeah. But I don't like the fact that they're making me get vaccinated to go to school. I don't have a choice. I said, you do have a choice. You have a choice of having your child at home with you, trying to teach him how to, 11th, so sixth grade, starting with some math, long division, let's say, or something. You're gonna teach them that, and then you're gonna have to be home to be with them. And she thought about it. She said, he needs to be in school. So the school seemed like it was more important than anything else. And so she went on reluctantly and got him vaccinated. Then he could go to school. And then he needs his second shot to see. Well, he got his second shot. So now he's going to need a booster. So it worked. And it was that outside influence of a school mandate that made the difference.
Yeah, we're having a problem here in my pediatric practice because children are sent home for the bare minimum of symptoms. And we're getting a lot of tests. We're getting a lot of positives. I wonder in my own mind, if we were to test for the flu in the same way, in the same numbers that we're testing for the coronavirus, if you wouldn't get a lot of positive flu cases described, because we're seeing so many positive tests. The thing, can you share with us some of the data that shows that children who are, for the last year, who are out of school have fallen behind significantly, especially African-American children?
So I honestly cannot quote you clear data because I don't have it at hand. However, it is clear they're falling behind in terms of the vaccination, but academically, as you mentioned, children do not learn by a screen. They need a teacher in front of them that keeps their attention wrapped. They need the interaction with the other children. They need to be in an environment that is a learning environment. You're sitting in your living room or in your bedroom or at the kitchen table. That's not a learning environment. That is not school. It's the way they go. That's called a school. And so that where they're sitting is not a school. And we have data that shows that we are farther behind academically on any standardized tests, any measure of academic performance. We are behind. And I have seen one of my best friends is a teacher, inner city school in Philadelphia. And when he was teaching online, these kids would not pay attention. They just wouldn't. They wouldn't even show up, some of them. When they're in the schoolroom, it's harder on him, but he knows and has told me that these kids are learning.
Well, first, I think that you're absolutely correct. And I think parents need to take that into consideration as one of the many factors that they use to make a decision about whether or not to get their children vaccinated. As clinicians, we always look at risk versus benefit. I mean, what you see on TV are all these infectious disease experts from around the country, telling you from Johns Hopkins and Harvard what's going on with the virus. But we're on the front lines. We have earned the trust of parents. So consequently, one of the messages that I'm giving to people is if you want to know about, you've got questions, CNN, that's not the place. Talk to the people who've been taking care of your children since day one. And talk to them not only about the coronavirus or the COVID-19 virus, but the fact that they're missing many of the other immunizations that they need. Do you remember any of the phase of life when we didn't have so many vaccines? I remember all of them. I go back to the iron lung with polio, the big epidemics of measles, the mass numbers of meningitis without vaccines. Do you remember some of that period, Dr. Brooks?
Oh, are you kidding? So simple thing. There's a vaccine against pneumococcus, a bacteria. It's number one cause of ear infection. We're not even seeing as many ear infections. There was another bacteria, just being technical, we're talking on the medical side, meningococcus, and it causes meningitis, as you mentioned. We also had to worry about something called epiglottitis. There were so many, and we were worried about all. And if a kid came in sick with fever, we had to worry about all of these things. So now that we are immunizing, and you mentioned, I think about chickenpox, and I think about measles, because people didn't realize that 1 out of every 1,000 children that got measles, or people, but generally children, died. Because what happens with me is your skin gets, you can get encephalitis. Now, chickenpox, 1 every 2,000, because they can get infection. They get all these, the little bumps, and then they scab up. The kids scratch them to get infected. So there were, even though these seem like benign conditions, people died from them, children mostly. So yeah, I clearly remember all of that. And I am so happy that we have these people. They say that after clean drinking water, vaccines were the greatest public health advance of the 20th century. They are now saying the 21st century, one of the 10 gravest threats to the public health is vaccine hesitancy. So we actually are a victim of our own success.
Yeah, so I think that's an important period. I mean, to remember. I mean, we wonder. I wonder now, because most of the patients that I'm seeing are those who are concerned and want to get a COVID vaccine test. And what happened to the ear infections and the meningitis, pneumonias, and things that we used to see? So many in our own practices. And I just think younger people can't appreciate the environment in which they find themselves now. The Omicron variant. Talk to us a little bit about variants. Talk to us about the Omicron, and talk about what the future looks like as we have to deal maybe with other variants.
So the way I characterize variants are, they're all this particular virus, the SARS-CoV-2 virus. But let's just say, and it's a culprit. So let's say instead of it having on a blue overcoat, it goes to a black leather coat, and then it may go to a red rain slicker. But underneath is still the same thing. But these variants are slight changes that allow it to slip in and evade your immune system. So we had the alpha, which was the main one that we had, and then we had the Delta that came out of the UK, and that one was rough because it was more contagious and as deadly. So what happens is the viruses just they evolve. They change their genetic code by a little bit. So now we have Omicron. Omicron came out of South Africa. So interesting thing about Omicron is, number one, I guess I call it interesting, but it's like 1,000 times more. No, not 1,000, but you make 7,000 times more virus, but it is much more not that level, but it's much more contagious. But number two, the preliminary information we're getting out of South Africa and even in the United States, it is not as deadly. So if you get it, you're less likely to be hospitalized or die. But if you are unvaccinated, the chances of you getting hospitalized go up by 10-fold, and the chances of death go up, 24-fold? So you really, really need to still stay vaccinated. We also don't know what's down the pike. So Omicron is around and people get it, and there's some thought, oh, I'll get it and then I'll be immune, so it's even good. But first of all, you likely still can get long COVID from it. And then number two, if you're unvaccinated, and I feel like I'm back on fraternity row. There's going to be another Greek letter coming that is a variant that we're going to have to face and deal with. And just that one may be twice as deadly and 10 times as transmissible. So that's the milieu in which we are operating right now.
Yeah, I think one of the things as a physician and as a doctor who cares for children is that you almost sometimes feel guilty to express the frustration that we feel about how this infection should be treated and how it should be managed. I mean, we understand the power of the vaccine. We've seen it, yet we still see many, many parents, especially in the African American community, hesitant to even consider getting it. And the reasons and the rationale are not anywhere near what they usually are for decision-making processes. And so I'm almost afraid to say that I'm kind of mad about people who are unvaccinated. I'm kind of mad, not so much because of themselves and their children. I think they may be protected, but the fact that being unvaccinated means we have to live with this virus for far longer than we should. And that vaccinations will make it possible for us to kind of corral this virus and probably get to it before it comes up with a variant that we have to really regroup and start all over with. And so I don't know how to deal with it, Oliver, exactly. I talk to parents every day, and I've never expressed that frustration the way I would really feel. Sometimes I got patients that I've been with a long time say, just go get the vaccine because I told you to get it. But that's not good enough for most parents. I really don't know how to channel that frustration of talking to parents when I know that this vaccine is safe and effective and would make a big difference in the lives of these children. How do you channel your frustration?
So you're stating something that is very true. And for those that are physicians here or aren't healthcare providers, it's really hard to look at people, especially like when I go into a hospital and I have to I see newborns and that the mother is COVID positive and they're supposed to be vaccinated. Pregnancy is higher risk for adverse outcomes. I've got to put on all this stuff just to go in. If you had just gotten vaccinated, none of this would be necessary. So, I mean, I try to channel that into positive actions. In other words, trying to find a way, some other word, some other phrase, some other approach to get those that are hesitant to get them vaccinated. But it's really a challenge. I also think that it's part of being a professional, being a doctor. It kind of goes with the territory. But I will say this: we've never had to deal with this before. I think that people may forget that part of it. We're getting into COVID fatigue to the point that we're thinking this is the way we've always been operating. No, but we as doctors, we really never had to deal with it on this level. I mean, we've had vaccine hesitancy, but it wasn't when we were looking death in the face, where people didn't get vaccinated. People didn't get the flu vaccine. Yeah, there was death, there was problems. But with this COVID-19, this is a pandemic, a once in what 2019, 18, where it was before, so 103 years. It's I don't have a good answer for you, Dr. LeNoir, and you're an allergy immunologist. I mean, you know more about this than almost anybody. I remember what you used to say: "Don't fall for the okie doke." Maybe try saying that to them one time, and maybe that'll feel a little bit of a release because you said something that you believe in, and it was not, it was non-contextual. You just said it. So, I mean, that's another thing. Try that sometime.
Yeah, I think we're just going to have to keep talking about it because the hesitancy seems to be more entrenched now in the people who are refusing to get vaccinated. Well, what do you see in the future for this phenomenon? We talked about hesitancy. We talked about how difficult it is. We talked about how many more people are really getting vaccinated, but still there. What do you see? How do you see this playing out, this whole pandemic?
So it's a good question because with Omicron not being as virulent, people are kind of letting their guards down a little bit. So, I'm not that worried. What people were saying is there's going to be a class system. There's going to be the vaccinated and the unvaccinated. I mean, right now you have to show your vaccination status when you go inside a restaurant in many places. If you fly out of the country coming back to the U.S., you have to show that you got tested. So those that are unvaccinated, I think, may end up being a little marginalized. And that may be another component to allow to force them or to encourage them to get vaccinated. So I do see that there's going to be a duality. I also believe that I know that there will be more variants. It will happen. And I ultimately believe that what's going to happen is this is a pandemic, which means an infection spreading worldwide at large rates. That's kind of the definition of a pandemic. It's going to become what we call endemic. It's going to smolder. So we have a fire. We've gotten the fire down from 5 alarm, I think, to like 1.5, 2 alarm. And then we're going to have embers, but those embers will never be extinguished until we get 90+% of the people vaccinated. And then I'm guessing that even then, at least for the foreseeable future, say 5 years, likely going to have to get revaccinated like you do with influenza.
And we haven't even dealt with the fact that most of the world is not vaccinated. I mean, not even close. Right. And so consequently, that means that the fertile ground for development of variants, fertile ground for this virus to spread and continue to cause death and disease in areas of the world that we should be concerned about. One of the things I'm concerned, and one of the issues that comes up for me is, what can I, as a Black doctor, do to help depoliticize this issue so that it doesn't become, a right-wing, left-wing, issue, and it does become more of a we are all, as we say at the African American Wellness Project, we're all in this together. What should we be doing?
So you made a very valid point that often people forget, especially in the United States, that globally the vaccination rates are abysmal. They just don't have the access. They don't have the infrastructure. So I think, there's no saying think globally, act locally. I think that just keeping that in your mind, what you just said is relevant. And I also think we do need to depoliticize this. And so for us as doctors, as scientists, as engagers of the community, just be very straightforward. I think it kind of got to roll past that. And maybe this is the type of thing that may bring us together. Maybe we can, the right, the left, the Republican, the Democrat, the rich, the poor, the black, the white, can say, okay, let's forget our differences and come together and fight this fight. I think about the movie War of the Worlds. They had to fight these aliens. Your bitter enemies, China and Russia, but China and Russia, United States got together to fight fight at the War of the Worlds. Things get rid of them. Then you can start fighting with each other again. So I think that it's a real challenge, but I do believe that over time, I think people are going to come together. So I think support the WHO, support the United Nations, support organizations like Doctors Without Borders that are international. The word inter, in between nations, international. Look to those groups, and then talk to your representatives. Look, I understand you're a Democrat, I understand you're a Republican. The virus does not check your political status before it invades your lungs.
And so for those of you who are listening or looking at us and listening to our program, you have to understand our passion. As Black doctors, we tend to love our patients. And as Black doctors who take care of children, we really tend to love those patients. And every one of our patients we give something to. And some part of me as a doctor goes into development and the growth of your children. So don't blame me for my passion about the vaccine. It comes out of a deep feeling that I want the best for you and for your children. So Dr. Oliver Brooks, thank you so much for taking the time. You've been on the front lines. You've been a good guest for us. And we also want to say that on blackdoctor.org or the African American Wellness Project, we're just going to keep talking. We don't know what else to do, but keep talking, keep mentioning, but don't blame us because we're passionate about trying to get you vaccinated, because we come from the side that says we believe it's best, and because we love you, we need to do that. So thank you very much for joining us today.
Thank you for having me. Excellent discussion, Dr. LeNoir.
All right, our special guest has been Dr. Oliver Brooks, and you have also been our special guest. Remember that the Wellness Watch comes on every Wednesday from 5 to 6, and sometimes it's replayed. We want you to remember, of course, that health is your biggest asset. So protect it. I'm Dr. Mike LeNoir. We'll talk